We have with us, once again, Dr. Tierney, the Commissioner of Bureau of Public Health. She presented to this committee, this was last week now, and was unable to join us on Friday, but she's back. And I didn't know, Dr. Tierney, if you had additional remarks that you would like to start off with, and then we could start with questions, because a lot has transpired from the last time you were here to today, and particularly with the announcement of the governor with the home testing, and that's, I guess, going to be headed up by you and your organization. So I didn't know if you wanted to talk to us about that a little bit.
I actually haven't prepared any additional statements, and am here to take questions.
All right. Well, good. We'll go ahead and get started. Let me go ahead and start it off. A lot of members are collecting their thoughts on some things. In regards to the announcement yesterday with the home testing, I understand there's a team that's been assembled, independent team of experts being led by Dr. Andrew Welton. I think he's from the University of Alabama, I believe, and that he's putting together a team to go and do the testings in the various homes, but also, I guess, sector by sector, so more of a sampling of the testing. Is that correct?
I'm going to be honest with you. We told him the information that we needed, which was we needed a scientific study on home testing. We needed confirmation of the CDC's data, and we needed an odor threshold. And so that it's completely independent, all test designs and the entire thing will be done by him without input from us.
Okay. Now, the one question that keeps coming up, at least from the public that I talk with, is, and I also brought this up to the governor, and I, when we met, and still there's no answers on this, but maybe you know, do we have any idea what the byproducts are, if there's any byproducts of crude MCHM and PPH that once it goes through the processing treatment plant, that does it break down to any other types of chemicals or mixes, it becomes any other form of a chemical or compound? Do we know of any of that? I know there's been talk, and you disputed some of the suggestions that there's certain things it breaks down to, but do we have any idea what exactly it breaks down to at all, or does it break down?
I think the EPA is probably the best person to address that question to, and I have addressed that question to. I have been told that it will not break down into the formaldehyde that was suggested unless it is combusted at a very, very high temperature. That's just simply not how the chemical reacts. But we have asked them to look at the at that question.
Okay. Well, I know that in the paper today that Andrew Welton has been quoted saying that he said that with the help of the National Science Foundation and the National Institutes of Health researchers, they need to begin more toxicological studies as soon as possible, I guess, to study what it actually breaks down to, if there's any. And I guess what leads to the question is, if we don't know if it breaks down in other byproducts, then when we test for MCHM and PPH when it's coming out on a person's faucet, then we're not even looking at any other type of compound at all that could potentially be more damaging than maybe those, maybe not. But we're only testing for the MCHM and the PPH. And I know that I've studied, I'm not an expert, so I studied chemical engineering at WVU. It started out with chemical engineering. And I know that what comes in to processing and comes out on the other end isn't necessarily the same compound. But so if it does take different forms, and as it's going through the process and comes out, we're testing for the original product that was entered in that could have changed its nature coming out on the other end, and therefore, of course, it would show lower levels of that particular chemical. I'm just wondering, until we get a handle on what are the byproducts, or if there's any at all, how do we know what to really test for, other than the MCHM and PPH that was originally introduced into the system?
Well, Senator Unger, I'm a medical physician. I'm not a chemist either. I have to rely on our subject matter experts, and we have asked them that question. And I understand what you're saying. We've also asked the water company. And they've told me and all of us that for the certain products that have been mentioned, that there would be spikes in their phenol if they had those breakdown products, and that did not happen. And as I said before, these are good questions, and I think we all agree that more toxicologic studies need to be done, and we're asking for help from our federal partners to make sure those get done.
Okay. Well, that leads to the question that if that's the case, and there's still that unknown out there, then I'm just wondering why there was a okay to use lift, ban from the ban, okay to use, why that would be initiated if we're still uncertain of what's coming out on the other end. So how did you all come to the terms that it was, and I know you're not using the word safe, it seems like no one wants to use that, but an acceptable use, or I don't know what the term is today, but how did you all come to the fact that people could start using the water if we still don't know anything about the byproducts or potential hazards that could be?
Once again, we had to rely on our subject matter experts who are experts with chemicals. Nobody knew much about MCHM. So they looked at the available studies, did their research, and then they advised us that if it was below 1 part per million, that it would be safe to lift the do not use, because there should be no known harm.
Okay, and your subject matter experts, I know that when you were here before, I asked the question or requested that we get a list of those subject matter experts and their backgrounds, and you had indicated that there was some, you would have to go back and look at that because there was some confidentiality or I guess agreements
Yes.
or something you had to realize. Do we have, can we not know the subject
I would
matter
be
experts?
more than happy to provide you the list that I have.
Okay.
However, it may not be complete because they may have spoken to people that I'm not aware of.
Well,
But
I
at
think
least
we're
I guess
just
will be
going
a
to
starting
with-
point.
Yeah, I'm sorry.
It's not something I can rattle off. It's at least 60 or 70 names.
Okay, if you could provide that to us today, I'd appreciate that.
I will do my darndest. I do want you to understand there's been a death in our Bureau family, and I do have a funeral today. If I don't get it today, it will be first thing in the morning, but I will do the best I can.
Okay, thank you. Yeah, that'll be fine. The other thing, it says outside experts have expressed concern that MCHM and other chemicals from the leak, and you may not be able to answer this, but you may have been in conversations, that the chemical from the leak could have absorbed by a home plumbing system where it could continue to leach into water, even if only in very small amounts for some undetermined amount of time. It says, although in the last week's press conference, officials of the U.S. Environmental Protection Agency said they have studied this and disputes this theory, but not released their study. However, Dr. Welton has compared pipes to a sponge in which the chemical could be quickly absorbed, but perhaps not so quickly expelled over time. Is there any, it seems like there's conflicting, at least understanding if the pipes can actually absorb this and expel it. With U.S. Environmental Protection, has your team or come to terms of what it is, or are we still uncertain about that?
I think, as I explained before, that the chemicals KOW suggests that it won't do that, but that the EPA is currently investigating to make sure that the chemical doesn't have some unique property that would make it act different than expected, and is verifying the KOW.
Okay. And do we have any idea when that report or that research would be made available to us?
No, sir. I watch for it every day.
I imagine. Okay. All right, Senator Miller?
Thank you, Mr. Chairman. Dr. Tierney, thank you for being
Thank
here.
you.
I know this has been a hard couple of months for you. I'm curious on the Bureau of Public Health. I'm looking at your website on boil water notices and water down. What kind of, I want to know the protocols of how this takes place. How do you get those notices? Do you all check those, or are those phoned into you?
They have to be phoned in to us.
Okay. Because I noticed you had 6 yesterday, boil water notices around the state.
That's directly related to the temperature changes and breaking of pipes and mains, and it's an unfortunate circumstance. I think we're all anxious for spring.
I'm on that too. And I think your website's very, very informational. And you do talk about not just what the notices, the reasons for it's down. You do say boil water notice, or if it's a chemical spill, you do say leak. I noticed there was a leak in another area too. I guess I'm asking, how many folks do you have to handle these type of concerns?
Well, as you're aware, our budget has been hurt in the last few years. I don't have a large staff there. We do have several vacancies that we've been unable to fill. As you can imagine, it requires engineers, and it's a challenge.
You're relatively new in that.
Yes, approximately 1/3 of my tenure has been spent on water.
Okay. I'm also curious if you're doing testing, and I don't know if you're testing raw water, or is you?
Actually, we do not do raw water testing.
Okay.
We don't do testing like that at all.
Okay.
It's beyond our purview and our ability.
Because the question doesn't relate is if you found other surprises in water that you didn't expect to find.
I got you. Just as part of the team, I don't believe so from the communications I've had, but it's the DEP who does the testing.
Thank you very much.
Any questions? Senator Walton?
Thank you, Mr. Chairman. Thank you, Doctor, for being here today. It's from my understanding that dealing with the school systems and the schools, I believe it was yesterday, Meek Scholes had an issue that it was above the recommended parts per billion for the school system. Is that correct?
It was, it was, I think, 18 parts per billion, which is just barely above the 10 parts per billion. I know these numbers are confusing, and they're hard for everybody to follow, but that number is substantially below the 1 part per million. We're just trying to get all of our schools and our hospitals below the 10 part per million. It's just an additional safety factor.
I understand. And whenever a rapid response team goes to these schools, I know they track the state law was involved. Is somebody from the public health go to the school, or is
The National Guard goes and speaks and does the sample collecting and maintains the chain of custody. Then it goes to, the samples are split, goes to multiple labs so that we can have verification and duplication, make sure, and then the people from my bureau oversee the test results to make sure that there's no outliers or things are being done correctly.
And I understand last week there were 3 calls where the rapid response team went to schools and they did do the testing, and all the tests came back at below 10 parts per billion. Is that correct?
That's my understanding, yes.
And that's going to continue to happen. The team is going to be available to go to the schools and check.
For the foreseeable future, yes.
Okay, well, that's good. That's very good. Thank you.
Mhm.
Thank you, Mr. Chair.
Further questions, Co-Chairman.
Thank you, Mr. Chairman. In regards to the testing, is the testing being done at the end of laterals throughout the system? And how do people in the community request to get on the test list?
We're going to have to get back to you on that. I believe that their team is setting up either a website or a phone number. Once we know what that is, we'll make sure that it's well publicized, so anybody who'd like to be considered will be.
And to go back, talk about the MCHM. In your previous testimony last week, you had indicated that the chemicals that you all had gotten to test actually came from Eastman and didn't actually come from the tank itself. So I was just wondering if it's possible that there may have been some other chemicals
No, I
within
think,
the tank.
I'm sorry, that was probably a misunderstanding. We do have the Eastman samples so that they could help figure out standards and things like that. I may have misunderstood your question.
Well,
Yeah.
if that's the case, then have you tested that for all other potential chemicals that could be in there, such as free methanol, which could have broken down into formaldehyde?
I'll have to get back to you on that. I'm not 100% sure, and I don't want to testify incorrectly.
Thank you. And one more question, and I just wanted to know how the health-related monitoring has been going on.
It's continuing. The charts are, we're still collecting some, particularly from this last incident, and including them in the entire thing. Like I said, this needs to be a deliberate process so that we do it right and that it's reasoned. This is not something we want to get wrong. So we need to, it's pretty much a three-pronged approach, and that third prong actually has several prongs. We start with the surveillance of the population from our records that we were able to get. From that, and then we do what's called a CASPER, which is a community assessment test, which we're hoping to get started very soon. And then from that data, we will be in a place to figure out what will be the best long-term studies to do. But I think we definitely need multiple types of long-term studies, not just one type. But like I said, it's important that it's well-reasoned, that it's statistically significant, and it provides us the data that we're seeking, rather than just rushing in and perhaps spending a lot of money and time and then not getting the data or not getting accurate data.
Well, I appreciate you keeping
Yeah,
us up to date on
I will.
Thank you very much. Thank you, Mr. Chairman.
Thank you. Further questions by members? Other questions? Just on the long term, you had mentioned about the long-term effects, as well as, are you also looking at providing information training to physicians, local physicians to?
That's actually already started,
That
and
started?
started a long time ago, yeah. I've
Okay.
connected the local physicians with the CDC, allowed them to ask questions, provided information, spoken to them both directly and indirectly, and there's also been an informational sheet that was just finalized that should be going out to every provider.
Okay, good. And so that'll be ongoing, and you say that the CASPER, or the community assessment test, will be happening soon? Do you have
Very
any
soon.
idea when?
It involves coordination with bringing people in from the CDC. I'm hoping by this time next week, if it's not finished, that it will soon be finished.
All right. Any other questions? Delegate Ann.
Thank you, Mr. Chairman. Doctor, just out of curiosity about the testing, a little bit ago, you spoke at DEP and others are doing the testing. We have a baseline of what we call clean water or safe water. Okay, we've been testing for the toxins that we think went into the system. Have we found any other abnormalities in any of the
No,
supplies yet, or any samples?
No, sir. And American Water ran, West Virginia American Water, from their Charleston plant, what we call a full spectrum test. And that has, and they test for everything they're required to test for, plus they test for more, and all of that has been normal.
So no other toxins have been noticed, so if
No,
there's
sir.
a chemical breakdown of something, it should have been alerted somewhere, is that correct? I mean, we should have gotten some.
Well, you have to understand it's impossible to test for every possible chemical. There's something like 80,000 of them. But yes, they have tested, like I said, for everything they are required to test for, and then they have tested for more. And all of those tests have come back good. And I'm happy to provide that to you if it would make you feel more comfortable.
Thank you very much.
Thank you. Delegate Senator Laird?
Thank you, Mr. Chairman. You mentioned, going back to the
Sure.
the public health consequences monitoring. Did I hear you say that notification has gone out to providers to collect that?
Yes, some has. I mean, it definitely has, and then there's going to be even more. Probably some went out yesterday, and I'm trying to coordinate with the boards, both boards, the osteopathic medicine and the medical doctors, to get their listserv so I can email the information that was provided to me for the providers.
So these are written communications coming from your office?
Well, it's not from my office. We're actually created by, I know the CDC, the ATSDR, the Poison Center, the National Poison Center, and there's a National Children's Organization, and I'm sorry I don't remember its name, but I'll be happy to get it to you, have all jointly created this without.
Could we be provided?
Oh, sure. It's public information. It's yeah.
Further questions by members? Dr. Tierney, we appreciate you coming back again. Also, our thoughts and prayers go to you and all at DHHR for that loss, and condolences to you. And we look forward to continue working. I know it's been a rough several weeks, or well, now it's going on a month and a half. But anyhow, we look forward to working with you. I know you're putting in provisions of responding to this situation, but also looking at the long-term effect of trying to plan. And so you're kind of doing that all at once, and I know it's been very difficult. So anyhow, we appreciate you being here, and thank you. And if you could provide that information
Sure.
when you do get a chance tomorrow, if that's okay, since you have that
Yep.
to our staff, we will distribute it to the members here, and then we'll be in communication with you later.
Okay.
Okay, thank you very much.
Thank you.